The Bone and Joint Center at Florida Hospital Zephyrhills delivers innovative technology in hip and knee replacement surgery. Here with more is orthopedic surgeon Dr. Trey Alexander. Nice to see you. Pleasure to have you here.
Thank you. Thank you for having me.
Of course. Let's talk about Florida Hospital Zephyrhills and the Bone and Joint Center. What sets it apart?
So what sets it apart is we're creating a unique team that's specifically designed to help patients with hip and knee arthritis. And we're developing what we feel is a unique and progressive hip and knee replacement program.
Okay, and progressive to the point where you guys are really the only hospital in East Pasco that offers a rapid recovery hip and knee surgery, correct?
Yes, and so what we do with rapid recovery hip and knee replacement, it's a combination of multiple things that lead us to do this. But patients are able to get out of the hospital either the same day or the next day following a hip and knee replacement surgery.
You know, I'm sure a lot of people at home are hearing this and saying, how can that possibly be? But the technology has become such that you really can get them in and out, can't you?
It is. It's a combination of multiple things. Primarily our surgical techniques that we use, our anesthesia techniques, and then the technology of the implant.
Okay. Now, you're looking at somebody that is and I've been told this already by orthopedic surgeons, that I am a perfect candidate for a knee replacement because I have had years and years of trauma on this knee. So, I'm a 59-year-old man. I come in to see you, Dr. Alexander, and what are you going to say to me? What are you going to do? What's the process?
First of all, I want to know how bad your pain is and how much it's limiting your activities.
A lot.
A lot. Okay.
On both counts.
On both counts.
Right.
So the first thing that we would always suggest is to try something other than surgery, okay? Things like anti-inflammatory pills, cortisone injections, lubricant injections, braces, physical therapy. There are multiple other things to help with your pain other than surgery.
Done, done, and done. So now what? I've already been through all of this, so this is good. It's like a personal consultation here.
So when the pain is bad enough and it's affecting your activities of daily living, then that's when it's time to think about surgery.
All right. And so we're talking about, we said, a quick recovery, which is great. And so realistically, what is that approximately?
So if your surgery's in the morning, you're up and walking up and down the hallway with physical therapy that afternoon.
Wow.
Okay.
Sign me up.
If your pain is good enough and you're healthy enough, you know, from a medical standpoint, you can go home that day. Okay, I would say half of our patients over the past quarter go home the following day.
Which is fantastic.
So you're talking a 24-hour stay in the hospital for what has traditionally been and still is a major surgery.
Sure, yeah, no, absolutely. And, you know, overall, then what's the downtime? Like if somebody's active like me and you want to play tennis again, what would be the, you know, the downtime for that until you can get back up into the tip-top physical shape? So
people hear about their neighbor Joe who goes and has their joint replacement done and they're golfing in 1 week. Right. That's a rare entity, okay? People use a walker for 1 or 2 weeks, then a cane for another couple of weeks. Really, the first 3 to 4 weeks are the roughest time.
Sure. Once
you get to week 6, week 12, that's when people feel good and get back to most of their activities.
But after years of pain and torture, a few weeks of rehabilitation is not a bad thing at all. You know, which is fantastic.
Yeah, and the arthritis pain is gone from the moment you wake up.
See, that's, oh, God, that's music to my ears, for sure.
Now, you are going to be sore because it's replaced by surgical pain, but we know that gets better day by day and week by week.
The trade-off is so wonderful.
Sure.
It really is. And insurance covers?
It does. It does.
Okay. All right, well, you got me convinced, Dr. Alexander. Really appreciate it. To learn more about Dr. Alexander's upcoming seminars and Q&A sessions, visit the Florida Hospital Zephyrhills website. It's right there on your screen, fhzeph.org. Really appreciate you coming in, and thank you so much for my personal consult.
Oh, no problem.
Okay,
Pleasure to be here.
We'll be right back.